Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody. Thanks for tuning in for Direct Connection. It is open enrollment season. Coming up, we'll look at what people need to know to sign up under the Affordable Care Act. But first tonight, we focus on the sometimes confusing choices that face the tens of millions of Americans who are covered by Medicare. Joining us for this week's Primetime Living, which is produced in partnership with the Maryland Department of Aging, are Melissa Moreno, health insurance specialist with the Centers for Medicare and Medicaid Services, and Bernice Hutchinson, Chief of Client and Community Services at the Maryland Department of Aging. Thanks to both of you for being here.
Thank you for having us.
Thank you.
So Medicare open enrollment starts tomorrow, but folks may think, I have Medicare, I signed up. What is open enrollment in the context of Medicare?
Medicare open enrollment actually started October 15th and runs through December 7th. It's the time of year, every year, when Medicare beneficiaries should take a look at their coverage, decide whether the cost is right, the convenience, the customer service, and the coverage.
So it was October 15th, not November 15th. So we're behind the curve by a month. What do people need to look at? What are the key choices?
Well, they should already have in hand information about any changes that will be occurring to their current coverage, whether that's through a type of health plan, Medicare health plan, or through a Part D plan. So they really need to make sure that they've reviewed all of that information. If they need help, they need to reach out to someone that they trust to help them examine those articles that they've received, all that information, and then take advantage of this time, compare the other options that are available to them, and really make sure that they have what's going to meet their needs come first of the year.
Can we refresh everybody's memory for a second on just what are parts A, B, C, and D? A and B are kind of old school Medicare.
That's right. Part A and B are what we call original Medicare. So for your red, white, and blue Medicare card, that is Part A and Part B. Part
A is more hospital, B is more doctors.
That's correct. Part A is your hospital care, inpatient hospital care. It covers other things, but that's what most people think of as their hospitalization coverage. And then Part B is your medical coverage, and it covers a lot. So it can be your doctor services, medical equipment, immunizations, preventive care. But A and B is your original Medicare. Part C is health coverage that is a little newer. This is the Medicare Advantage coverage. And this can be an HMO or a PPO plan. It has all of your original Medicare benefits that you'd receive through Part A and B, but many times it also has your Part D prescription drug coverage included. So because these have networks, this is really an important key point that people need to be aware of, making sure that the providers, facilities that they like to use are included in their plan's network.
And those plans, the Medicare Advantage Part C plans, are offered by for-profit or nonprofit organizations outside of the government, and the coverage would presumably vary.
Well, they are offered by private health insurance plans that have been approved and contracted with Medicare. So once their plans are approved by Medicare, meaning that they have all of the Part A and Part B services and coverage, then they are allowed to go out and enroll people with Medicare into those plans. So in many cases, not only are they going to receive their Part A and Part B services and benefits, they're going to receive usually some additional allowances for things that are not covered under original Medicare. So that could be an allowance for glasses or dental or hearing aids. And usually their Part D prescription drug coverage is included.
Now it can be a confusing time of year for people who are looking at the alternatives. What are the main questions that Medicare beneficiaries might have?
I think they will have questions about their prescription drug plans. And one of the things that we often tell them is to take a look at your current coverage. Are the drugs that you're currently using covered by your plan? Can you afford it? They may have questions about a doctor moving out of network and whether or not they need to look for another physician. And a question might be as simple as, do I have to do anything during open enrollment? And for many people, if you're satisfied with the coverage, with the cost, with the customer service, and you don't have to do anything.
Let me remind our viewers, if you have a question about Medicare open enrollment, give us a call. We'll have the number up on the screen. You can also tweet your questions. The Twitter address is @MPT News. So what happens if you don't do anything? People, I imagine, get a lot of solicitations in the mail. They might get phone calls, but you can do nothing if you're happy.
This is a big time of year for fraud around Medicare, particularly with the solicitations by telephone. We tell everyone, be careful with your Medicare identity. Don't share it over the phone. People shouldn't ring their the doorbell selling policies. Be very careful and be cautious and avoid Medicare fraud.
How does it define Medicare fraud? Because I'd always thought of it as a provider, a doctor's office or something, overbilling the government.
That's right, and we typically know fraud as that, provider overbilling or billing for services that were not rendered. But we also use this opportunity to encourage everyone to protect their Medicare identity and to also be very cautious of those who sell plans and that they should do it in a particular way.
Let's grab a phone call from Fairfax County. This is Shane. Thank you for the call, Shane. Go ahead.
I'm retired 3 years ago. I have a Medicare A and B, but why I'm supposed to buy another insurance, supplemental insurance, and for medication, a plan for medication? Why?
Okay, thank you very much.
Why not? Because Medicare is not cover everything.
Okay.
Right, Shane, a very good question. Okay, so Medicare does not cover everything, and the idea of the Part C plans, the Medicare Advantage, is to maybe broaden out the coverage a bit,
Right,
but by reducing your network.
Well, what the caller is actually mentioning is that she has original Medicare Part A and B. So that doesn't cover everything. And so if someone doesn't have other prescription drug coverage, then they would most likely want to enroll in a Part D prescription drug plan. And in this way, they get total coverage, whether that's medical, hospital, doctors, and then Part D. It's a complete coverage. But she's also mentioning Medicare supplements. So Medicare supplemental insurance is a Medigap plan. And those are not sold by Medicare. They're sold by private insurance companies. And they are really intended to pick up the out-of-pocket costs after Medicare is paid. So we're talking about deductibles or your coinsurance.
I see. So that's something different than Medicare Advantage.
It is.
Learning something
Yes.
as we talk here. Let's take another call from Montgomery County. I think this is Dave. Thank you for the call. Go ahead.
Hi, my name is Ab Wolfie. How you doing?
Yes, sir. I thought it was a typo. I apologize.
okay.
Go ahead with your question.
I'm brand new to Medicare. Matter of fact, December will be my first one, for my first month. And I just received my first bill, and I signed up for the program where you take it out of my checking account. And I noticed in the corner it said this is not a bill. So does that sound like everything's going well with them taking it out of my account? I think it's the 20th or 21st they're supposed to take it out.
Very good. We'll get you an answer. Thank you. Does that sound right?
So most likely, if you're talking about an amount coming out each month from your Social Security check, is that correct?
Now the caller's gone.
Okay.
He said bank account, though.
Bank account. Well, if it's a bank account, then that could be either for a Part C plan, which is a Medicare Advantage plan, or it could be for a Part D prescription drug plan, which is different than the monthly Medicare Part B premium that comes right out of someone's Social Security check in most cases. That everyone has to pay. So if it's coming out of your bank account, it's most likely a Medicare health plan, like an Advantage plan, or it's for a Part D prescription drug plan.
Bernice, I can tell by the phone that a lot of people have questions about Medicare. Where can people get help?
Absolutely. This is the best part. We have what's called a State Health Insurance Assistance Program. We affectionately know it as SHIP. There are SHIPs all across the nation. It's a federally funded program here in our
Stands for
state.
something. State Health Insurance
Assistance Program. So if your callers or anyone that's watching this program this evening have questions, we have highly trained volunteers who provide unbiased support with making the Medicare decisions. They are trusted. They can give you decision support and help you through the Medicare open enrollment season and beyond all year long.
Where else can people find unbiased information about their choices?
The Centers for Medicare and Medicaid Services, because we know that not everyone will need hand-holding or decision support. Some people just need to find good, credible information, and they can make their own decisions. So 1-800-MEDICARE or Medicare.gov are also options. You can also go to aging.maryland.gov, which is our website for the Maryland Department of Aging, and that will help those who can self-serve.
So we have
go ahead.
Medicare.gov has our Medicare Plan Finder, which is a wonderful tool that will allow people to conduct either a general or a very detailed personalized search where they can enter in all their information, their providers, their pharmacies, their medications, and it will help them make a side-by-side comparison of plans that are available to them. And as Bernice mentioned, we have 1-800-MEDICARE, which is available 24 hours a day, 7 days a week, except for a couple of federal holidays. So that is a great resource in addition to the SHIPs.
Let's go out to Montgomery County. This is Hugo. Hugo, thanks for calling. Go ahead.
Yes, thank you. I am retired Navy, and I am fully covered with every aspect of Medical Plus. I'm questioning, am I forced, and why am I forced to have a medical med program, Medicare? Am I, or thank you.
So Hugo, before you go, you're saying you have VA.
Yes, I'm completely retired, and I have everything. Mostly here in the area. I live in Montgomery County. In Bethesda Medical, I have everything that I need.
All right, we'll get you an answer. Thank you, sir.
Okay. Well, if you have VA coverage, that's a wonderful way to receive your benefits, but Medicare is also there, and you know, you've in most cases already earned enough through your working years to have Medicare Part A as premium free, so you wouldn't be paying for it if you had worked 40 quarters through your working years and paid into the trust fund. Medicare Part B is another medical option that you can choose to enroll in, and it will provide you additional coverage for your medical services.
How does it work if somebody is older and less able to, say, go to a website to get information, and family members want to help? Do they have the ability to do that?
Yes, the SHIP is located in every county across the state. They're available by telephone, not just to the Medicare beneficiary, but also to caregivers, friends, anyone helping to make those decisions. They are also available by appointment, so you can even arrange for an appointment to come in one-on-one. And I'd love to give the number to reach the SHIPs.
Well, let's do it.
1-844-627-5465. And any county across the state has a SHIP program.
And you could probably reach out to the Department of Aging if you didn't catch the number to get in touch.
Absolutely.
Very good. Bernice Hutchinson, Melissa Marino, thank you both for being here.
Thank you so much.
Thank you for having us.
Appreciate it. Still to come tonight, we focus on Obamacare open enrollment. We'll be right back.
The MPT app puts our programs right at your fingertips, so you can choose when to watch, what to watch, wherever you want to watch it. Download it now.
There is one stage that is the Met and Carnegie Hall. It is the Kennedy Center and a club in Austin. It is closer than any seat in the house, no matter where you call home. PBS, the great American stage that fits in every living room. Supporting your PBS station brings the arts home.
This is a box a box that showed you a world beyond your own. It was just a box, but the world has changed, and so have we. And now the box can be almost any size or shape. And you decide what you want to explore. Anytime, any place. Break out of the box with PBS.
My child who's watching Super Y, and it said, what letter makes the sound R? And my 2-year-old is jumping up and down going, R, R, R. I love that. I wish I knew the genius that came up with Dinosaur Train. I mean, what little boy especially doesn't like dinosaurs and trains and to put them together in one show? My family does without a lot of stuff, but I would be horrified if we had to do without PBS.
Please support MPT.
Sometimes the tears,
I get a good feeling, yeah.
Wanting to die. Nobody tells you
I believe
that without it,
I really do believe that
life can be appallingly boring.
Something's got a hold on me here.
You're making a mistake.
Am I? This is really very promising.
Something's got a hold on me right.
I don't think this is such a good idea.
You've been talking to my mother.
I am about to commit murder.
She always had a bit of a dark side. Trying to scare me now. Let me give you a story.
God above! He's in love.
I really wasn't. Stay away from my wife.
You got any idea the pressure I am now under?
And joining us now in the studio is John Crom, the acting director of the Maryland Health Exchange. John, thank you for being with us.
Thank you for having me.
You are in your open enrollment period as well. When does it end?
That's right. Open enrollment ends January 31st, but in order to have coverage before January 1st, you need to enroll by December 15th. So we want to make sure that all of our consumers are coming and shopping before December 15th.
What happens if somebody signs up for a plan after that?
Sure.
Take effect February 1?
Exactly. So if you enroll, let's say you enroll January 15th, it'll be effective February 1 and so forth.
Okay, so the big news headline about the Affordable Care Act plans in Maryland over the past couple of months has been the stiff, shocking price increases, 25% up to 30% in some cases. Is that worst case, or is that really across the board?
Sure, that's average. So we certainly have some plans that had less of an increase than that. Rate increases are a real issue. It's something that we're concerned about and we're watching, just like every state across the country is. But the important thing to remember, though, is that for our consumers, about 9 out of 10 of our consumers receive some sort of subsidy, and many of the remaining uninsured in Maryland would be eligible for a subsidy that we think would offset a lot of those increases. So let me give you a real-world example. Last year in Baltimore, the lowest cost silver plan for a 40-year-old Baltimore resident making about $30,000 a year would pay about $208 per month out of pocket with their subsidy. In 2017, same person, same plan would pay $207 out of pocket after their subsidy. So those subsidies really make a big difference in terms of what our folks are going to see in terms of increases.
But certainly for some percentage of people who get their insurance through your website, they're paying all of it.
Certainly, yes. So, and this is what's happening across the individual market. And again, it's something that we're concerned about and that we're working with our sister agencies across the state and our carriers to really get a handle on it.
Similar to the complexities that we were talking about with Medicare in the previous segment, this stuff can be pretty complex. I mean, sure. The difference between the different flavors of plans, the differences between individual providers and what's covered, what's not, the copays for doctors and specialists and urgent care. You almost need a degree in this stuff to really make an informed decision. How do you help people with that?
Sure, that's a great question. We have about 1,500 consumer assistance workers and authorized producers deployed across the state, including at our call center, to provide assistance. We know that it's a complicated application and a complex decision, so we do a lot of training to make sure that those folks can provide the best advice possible. But we've also done a lot of work on our website to streamline the application and streamline the information we provide to consumers.
Let's grab a phone call from Baltimore City. This is Doug. Doug, thank you for the call. Go ahead.
Hi.
Hi.
We are a family of 3, and one of us is a son who's on our plan because we're adults, and he's still on our plan. I'm turning 65 in July, so the plan we have now, how does that, what do we do when I turn 65 and go on Medicare and the rest of us are on an individual plan?
Great question. We'll get you an answer on the air. Thank you.
That is a great question. So here in Maryland, what we would do is, first, I would recommend that you shop now and enroll for 2017 because you're not turning 65 until later in the year. And then what we do in Maryland is at the end of the year, we'll let you know that you're eligible for Medicare and you don't need to buy on our exchange.
So what happens then to the rest of his family?
So they can, if they choose to wait till the end of the year, they can all enroll as a separate, in a separate plan. Or if he wants to terminate his coverage in the middle of the year, which he can certainly do, he can have his family shift over to their own plan.
Because there are situations where, despite the deadlines that are coming up, somebody, if they change jobs or they lose a job, they can apply midway through the year.
That's right. We're a year-round operation, not just for our qualified health plans, but also for Medicaid, which we do. That's 85% of our clientele. But yes, all year round, if you have a life event change, that could qualify you to buy coverage later in the year.
Let's get a call from the Eastern Shore, Queen Anne's County. This is Tim. Tim, thank you for the call. Go ahead.
Hi. Hey, thanks for taking my call.
You bet.
Hey, my question is, the subsidy for the Obamacare, is that based on gross income or is it adjusted income? I mean, I made contributions to my 401k and taxes were taken out. So is the actual subsidy based on gross income or your adjusted income?
Tim, thank you.
It's actually based off of your modified adjusted gross income. So that's complicated, I know. We have resources on our website to help folks walk through that. It's something that I would encourage folks, if they have any questions about, give our call center a call, because it's one of the main questions that we help answer at our call center.
You did an event today focused on college students, a lot of whom, as we've heard, are covered under a parent's plan, and others maybe through a plan that the individual college has. What's the message to that group?
That's right, but we still see a lot of young folks in Maryland who don't have insurance, and we're certainly here for them, and we want to help them get into coverage. Our message to them is, listen, nobody plans to get sick. You may be young and healthy today, but we want to be there in case something happens. And one of the things that we've found in talking to young people is that they don't know what's available to them always, and that they don't know that there are affordable options. So we'd like for them to come and shop on our website.
We'll leave it there. John Crom of the Maryland Health Benefit Exchange, thank you for your time.
Thank you.
Appreciate it. Finally tonight, we are sad to report the passing of Gwen Ifill. The NewsHour co-anchor and host of Washington Week died today following a battle with cancer. Ms. Ifill was a pioneering figure, the first African-American woman to both co-anchor a national newscast and serve as solo anchor of a weekly national public affairs show. In addition, she moderated numerous presidential debates. Gwen Eiffel's TV career actually got its start here at MPT. She was a reporter for the Baltimore Sun when invited to join a discussion program. She received 8 honorary degrees, most recently from American University in Washington.
You can be the person who turns toward, not away, from the chance to rise above the fray. And you can be the person who trains yet another generation to do better at it than you did. I was drawn to journalism because of the need to be the necessary voice, not to force my opinions on others, but to broaden the stage for the debate. And along the way, I have to say, there were some perks. I was played by Queen Latifah twice on Saturday Night Live. Honorary degrees are nice, but that was really cool.
Good evening.
And we just recently found this tape in the MPT archives. This is the mid-1980s, and that is Gwen Eiffel as a young newspaper reporter filling in as guest host of Maryland News Wrap here on MPT. Gwen Eiffel again passed away today. She was 61 years old. A NewsHour executive called her a standard bearer for courage, fairness, and integrity. Now, for all of us at MPT, I'm Jeff Salkin. Thank you for watching Direct Connection, and have a good night.
This program was made by MPT to serve all of our diverse communities.